Thank you. This is the Crisis Stabilization Facility Committee meeting for August 15th, 2024. We do not have a quorum in the meeting at this point, but chosen to go ahead and share the information for recording individuals in the public that may want to access that information and those components. I'll do the land acknowledgement as we begin. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. So my first agenda item in regard to our meeting today is to share updates and information in regard to the Ann Deacon Center for Hope and talk just a little bit about the census for Q1 and Q2 of 2024. I think I have the ability to share my screen. Thanks, Jill. And hopefully folks can see that when I share my screen. I don't generally see attendees, so looks like it's sharing at this point in time. Just for a quick clarification on this this busy slide, the top portion that's in yellow is for both of our providers. That is Pioneer Human Services at the top and Compass Health at the bottom. That is Q1. We actually shared that a bit earlier in some meetings, but that's the Q1 information. And then just below is a duplicate, if you will, of Q2 information in green. And also I added the year to date information in red font. For withdrawal management services detox during Q2 from April to June, there were 1,456 bed days. That is simply the calendar days compiled during that time that services were able to be offered, which is 7 days a week. The utilized beds, of course, is a number of beds that were being used at a point in time at midnight at any given evening. And so that is at 1136, as everyone can see, for detox, and 952 utilized beds for mental health stabilization. That works out in the detox to a 78% bed utilization. And just sort of running across and staying on that detox data and information, there was 562 referrals that were received during Q2. A bit lower than was received in Q1. Law enforcement, a great number there in terms of utilization of at least 12 individuals that were facilitated in one way, shape, or form to detox during that quarter. EMS, typically community paramedics, had provided 3 individuals, transportation and support. We had 5 from GRACE. Mobile Crisis Outreach Team is what MCOT stands for. And we had 1 individual that were referred through that. The Mobile Crisis Outreach Team typically works with individuals that are struggling more primarily with mental health issues, and so we'll tend to see more referrals to the triage side of the facility than to the detox side. Peace Health is one of our larger referrents with 51 individuals referred. The jail, I'll talk about that a little bit when we talk about Compass Health, has 0. Other professionals we can imagine within the community that utilize referrals to the process and services at 83, and then self and family being the largest number of 403. Base Camp has utilized the Crisis Stabilization Center and Deacon Center for Hope, to some extent, with individuals that are involved there and end up getting referred. To drop down to, this is again the mental health stabilization. Our provider is Compass Health that provides that service. Obviously, same number of program bed days because same calendar. Utilized beds for quarter two was 952, which is down from the 1,044 that occurred in the first quarter. That works out to a 65% bed utilization. Continuing to hope for a higher percentage than that. The year to date is 69%. I wasn't able to actually label this particular row. They received 739 total referrals in the 2 quarters. A pretty close referrals received numbers from quarter one at 362 and quarter two at 377. Law enforcement use of this side, 9 individuals that were referred, EMS 2, our lead program, 1 individual, our GRACE program 1, a higher number of mobile crisis outreach team referrals for individuals that are struggling with a mental health crisis, and so have 8 there. Pretty significant number comparison in terms of Peace Health referrals to detox being 51, and then to the mental health stabilization of 83. A really great component, in my opinion, of the services that are offered at the Crisis Stabilization Center is oftentimes individuals that are being released from jail or working with a case manager or a program, a diversion program within the community, and will be releasing from the jail and oftentimes be scheduled to admit to some kind of inpatient treatment services, whether that's substance use disorder or mental health inpatient. And so the jail can refer individuals to the Crisis Stabilization Center for that time frame in between release from the jail and admission into an inpatient facility. And so that is oftentimes what this process is about. Very helpful because, as we all know, pretty risky time for an individual to be released from the jail when they have scheduled services in an inpatient setting. The individual being able to get there, without a lot of resources in the community and so forth. Other professionals, 90 referrals, self and family, 178 referrals, and we didn't get any referrals for mental health stabilization from base camp during this quarter. I did want to point out, and I made reference to this, that I also am tracking just a year-to-date bed utilization. The withdrawal management services detox is at an 80% currently through the 2 quarters, and mental health stabilization is at a 69%. So feeling pretty positive about that, continuing to work with services and programs, the providers to continue to enhance that number. And I'll talk about that information in detail just a little bit later. I'll stop sharing this information at this point and just check in if any attendees have any questions just in regards to the data that I've shared. All right, hearing none, I will continue on with the next topic, which is a really enjoyable topic for me anyway to be sharing. Just in regard to supporting the increase of bed utilization at both the the withdrawal management services and mental health triage, we have within the response systems division, a division as a component of the Whatcom Health and Community Services, we've continued to meet with the directors of the both sides of the house at the crisis stabilization facility, and continue to work with them on a number of different projects. And I'll just sort of list some of those. I'll quickly go through some things that I've made reference to earlier, but I think that these are important steps that the county is taking to support our providers in maximizing the utilization of the available beds at the facility. The providers actually email the response systems division the current census each weekday, and we distribute those census numbers to all of the response systems division staff, which of course would include the GRACE, the LEAD, the ART program, co-responders, et cetera. It's also distributed to the Whatcom County Sheriff's Office, behavioral health deputies, as well as Bellingham Police Department and our community paramedics, so that they have current that day information about availability of open beds in the facility. The providers also submit monthly census. This is where I am able to compile this data that I shared with you today, just in regards to, bed utilization, referral numbers, that sort of thing. We also have a monthly crisis systems oversight committee meeting. We meet on the second Monday of each month. The attendees at that meeting include law enforcement, emergency medical services, fire department, obviously the providers, mobile crisis outreach team, Volunteers of America, our PACT program, Peace Health, and Response Systems Division. So some great input and information. It's really beginning to develop into a venue of where crisis services in general are spoken of, challenges, new developing components, discussions that can happen just relative to crisis service delivery on, sort of all levels. So I think that is a very helpful meeting. We have sort of a standing agenda, with that, so people know what to expect. But oftentimes we'll, provide some specific presentation information for individuals. I'll share an example of that as we kind of continue on down this list. I mentioned before that we have a quick access advisor card for law enforcement and other first responders that just includes all the information about admission, anything that might exclude an individual relative to a health issue or something of that nature, just to have a quick access point for our first responders out in the community that they can take a look at that. We have distributed several hundred of these to the various first responder and law enforcement offices. I've mentioned before that both of the providers I have seen respond with specific documented streamlined protocol for law enforcement and first responders when they do a drop off of an individual that is needing services. And what I have continued to hear is that drop off time is very short. At this point in time, there is not an expectation of the individual's first responders or law enforcement staying any longer than to basically report some information if there is pertinent information for them to provide. And then they're on their way. Historically, we had some challenges with a lack of transportation if an individual wasn't eligible for admission. Again, I will address that particular piece, but that transportation issue has been addressed at this point, and law enforcement or first responders are no longer expected to transport an individual that may not meet criteria. We also will have individuals, communicate in terms of, we have a bi-monthly behavioral health crisis services meeting with providers in the community, and we continue to push information out to providers in the community, behavioral health and crisis related responders, just about the Ann Deacon Center for Hope and the services that are available. More recent updates that I'm very excited about, to be honest. Historically, at least the time that I have been and worked with the county, 2016, our previous triage facility had the front door was locked. If an individual or first responder came to the facility, they would essentially ring, a bell. There was a communication methodology for the staff to open up the front lobby door if an individual did, ring in or notify them that they were there. And that has been true when the Ann Deacon Center for Hope opened as well. In July, the providers collectively got together and were able to actually open the lobby door at this point in time. So the lobby door at the Crisis Stabilization Center remains unlocked and open. Anybody, walk-up guest and or obviously professionals, first responders can immediately access the facility. There's an individual at the reception desk to support and help individuals, greet them, and obviously coordinate services. So a very significant achievement in my perspective that's never actually been true before. Um, is now in place and occurring. So hats off to the providers for taking those particular steps. In connection to that, we're in the process of installing a panic button for the front lobby, just in case there is an emergency situation of where Bellingham Police Department can be informed that there is an emergency situation without a phone call being placed necessarily. An additional thing that I'm just really happy to report is that Compass Health, again, our mental health stabilization provider at the facility, has opened up additional support at the facility. It's actually supported through the Mobile Crisis Outreach Team, which is also a Compass Health entity, in which the program is designed to prescribe psychotropic medication for community members that have lost or had their medication stolen, or in one way, shape, or form have had their medication, psychotropic medication interrupted. This is a very common, situation that individuals will run into for a variety of reasons, but can obviously escalate to a point of where they can experience some pretty severe reactions and possibly a crisis, a mental health crisis. The challenge is that the individual may be less and less capable of accessing their physician or their prescriber or wherever that medication is coming from, and don't necessarily have support to do so. Therefore, furthers this process of sort of deterioration, decompensation of the individual from a mental health status. So Compass Health has taken it upon themselves to, provide this additional support to the community at the Crisis Stabilization Center. It's actually facilitated by the Mobile Crisis Outreach Team and obviously a prescriber at the facility. The really nice part about this is that the engagement of the Mobile Crisis Outreach Team allows, through their contract framework, allows individuals to be that are open to it to be supported and resource given to them for a 2-week period of time beyond the initial contact, and et cetera, which may be, of course, necessary if for some reason they've moved into a crisis process. So this will absolutely, in my opinion, reduce the number of individuals that have, a high risk potential of coming in contact with law enforcement and or making calls to emergency medical services, fire, that sort of thing. So it's a great resource that the Compass Health has brought to our community. I'll continue to report on that. I mentioned the transportation challenges that historically, as we initially opened, excuse me, the Ann Deacon Center for Hope, that if an individual for one reason or another wanted to leave the facility and or did not meet admission criteria, there really was no transportation from the Division Street location. And so the standing kind of expectation was that if an individual, got to the facility and by virtue of law enforcement or other first responders didn't want to admit or did not meet admission criteria, that the first responders or law enforcement were expected, if you will, I'll put air quotes around that, but were expected to transport the individual to where they needed to be by virtue of the fact that they were ineligible for admission. No longer true. We have just completed a letter of agreement with a local cab company that allows the providers in the Crisis Stabilization Center to contact the cab company, give the cab driver the address of the individual's home address or where they need to be transported to, and provide that transportation for the individual at no cost to the provider, because that became an issue. Obviously, our reimbursement rates for the services that both Compass Health and Pioneer Human Services provide are very, very tight, and so having them pay for transportation is not a sustainable process. Both of the providers also, at the request of Whatcom Health and Community Services, actually visited the Dijwalik Wellness Center in Anacortes. They graciously hosted a tour and also a rather extensive discussion around trauma-informed care and how the Dijwalik Wellness Center implements a trauma-informed care setting. We were concerned that lack of trauma-informed care and person-centered orientation at the Crisis Stabilization Center might be having an impact and an effect on individuals being willing to stay in the facility and or actually admit in the facility. And so both of the directors of Compass Health and Pioneer Human Services responsible for the Crisis Stabilization Center services stepped up, engaged in that process, and have done continued training with their staff around trauma-informed care. I don't know if this is directly related to that, but one of the things that I've seen, this has actually been for a couple of months that this has been true now. I think that everybody is aware that we have a systems improvement form that's available in the community for individuals that experience a challenge as far as an admission, whether that happens to be a case manager or an EMS professional or a community paramedic, that they can submit an online systems improvement form. And historically, we've gotten a number of those. It's a really great way to actually gather information and address issues because there's better documentation of that. But interestingly enough, following this real push to do additional education, clarify expectations, and et cetera on trauma-informed care, we have only had one systems improvement form submitted, and it actually had to do with storage of an individual's belongings that was a challenge. So again, I don't know that those are directly related, but I feel really positive about the fact that we're seeing a decreased number of systems improvement forms being submitted. Those documents actually come directly to my email so that I can respond to them, as well as my manager's email, so that we can take actions on those. So more to come. We'll see if that's a trend or happens to be a one-off kind of experience. So yeah, I'm feeling very positive about that. Compass Health is also in some of our projects and communications. They've also submitted a proposal for a Pyxis. This is a medication distribution machine, for lack of another description. I'm not horrendously familiar with the platform, but essentially it is a medication distribution equipment that allows Compass Health to store and maintain a number of different medications, and it's a controlled storage. So it is the preferred approach and method to be able to do that. Not necessarily connected to the additional support program that I was talking about, but it does increase the services that Compass Health will be able to provide by virtue of having this piece of equipment. So the county is working with Compass Health in regard to that particular proposal, and is again just another one of the projects that we're working on to support providers. One of the other things that we realized, actually report back in our stakeholders of law enforcement, was that there's actually no emergency access for law enforcement to the Crisis Stabilization Center. I mentioned that the lobby is open Monday through Friday for sort of the daytime work hours, but if the building and the front access door is locked after the regular daytime hours are completed, law enforcement actually has no method to get into the facility if they were in fact called to the facility for an emergency situation. So we're actually addressing that as well, of installing key lock boxes at the entrance for law enforcement and first responders. There would be a combination, and that combination is obviously kept with the shift sergeants and various leadership individuals, as well as WACOM. They would have the combination so that the individuals, if they were arrived at the door and realized this, that they would have that dispatch information. So great collaboration and coordination in that regard, and just ensuring the safety of the clients and obviously of our providers. We are also having discussion about the development of a county-funded coordinator position for the behavioral health campus. I think that folks are aware that what's occurring out on the Division Street is that we have obviously the Ann Deacon Center for Hope. The plans are continuing to develop for the 23-hour crisis relief center. We have an office that houses a number of response systems division outreach staff, as well as the development of a resource center on the clinic side of our 2028 building in Division Street that will house the Jwalik Wellness Center staff, Swinomish Tribe, and also mobile medical units. So this coordinator position isn't fully designed at this point. We're really in discussion with it, but that individual would coordinate communication, interaction with staff, that sort of thing in the facilities out on the behavioral health campus as programs and services continue to develop. Just having a coordinating individual that can support any and all of those programs, referrals between communication, addressing needs, etc. That was a mouthful that I certainly threw out there. I don't know if there are any specific questions that individuals had relative to the relationship development and the work between Whatcom Health and Community Services and our crisis stabilization facility providers. But I'm more than happy to answer any questions that folks might have.
I just want to say great update, Perry. Thank you so much. I learned
Thanks, Mike.
things. Yeah.
Fantastic. Yep. And by all means, reach out. You've always been super supportive, and any information I can give you, by all means.
Yeah, likewise, Perry. I have no questions, but thank you so much. Very informative.
Okay, fantastic. Well, then, so to narrow down into kind of the last couple of bullet points, one is actually a very short response bullet point on our agenda. That is the 12-hour law enforcement holds. Talked about this, in every meeting actually that we've had prior to this, that one of the challenges that we're having at this point in time is that the county legal team has concerns about law enforcement utilization of these 12-hour holds. Again, for folks that maybe don't recall, the 12-hour holds are essentially an involuntary hold in a voluntary facility. This is allowed through RCW, and essentially what can occur is law enforcement actually via RCW has the ability to offer an individual the opportunity to be admitted to the Ann Deacon Center for Hope as opposed to going to the jail. There is at that point in time a discussion that the expectation is that the individual remains at the facility for a 12-hour period of time. We hope that they would remain longer. Once they're engaged, there's a safe place to be. There's food, clean clothes, those kinds of things. But the individual is actually in an involuntary status for a 12-hour period of time. The challenge in the credentialing for the facility is that the staff the licensure does not allow the staff to go hands-on for any individual. If a person demanded to leave, that is very clearly stated in the RCWs and certification that the staff would attempt to talk to the individual and engage them, but ultimately cannot physically stop them from leaving. In the event that an individual was on a 12-hour law enforcement enforcement hold and then chose to leave the facility, the responsibility of the provider at that point in time is to contact the arresting agency and to inform them that the individual has indeed left prior to that 12-hour hold. After the 12 hours, there's no reporting, there's no information that has occurred. This is only true for the mental health stabilization side. Compass Health has actually gone to fairly extensive training and staffing arrangement to meet the criteria, as well as applying for and receiving additional certification from Department of Health to provide this 12-hour hold. After all of that process, essentially, again, as I mentioned before, the county legal department had concerns about the liability of doing this, is in communication or has, provided communication to the sheriff's office at this point in time. Appropriately, in my perspective, the health department, myself, have been excluded from that information because the legal department, county legal department's client is the sheriff's office. And so this information has been provided to the sheriff's office. We certainly stand, prepared to have any discussions that those entities are open to having with us in regard to the possibility of using this. I'd love to see those services occur in that way, but certainly understand that there's considerations that need to take place, just in regards to a legal perspective and also law enforcement's perspective of this. So that's where we stand in regard to the 12-hour law enforcement holds. Obviously, I'll provide any updates that that occur, in this regard. Lastly, just an update on our 23-hour crisis relief center. I think that everybody is in this meeting is pretty familiar with the fact that we received funding or initial funding anyway for crisis relief center, 23-hour crisis relief center. The determination of the location being on the behavioral health campus, actually west of our 2028 building, working with the executive's office and a number of individuals from other divisions within the health department to bring this process about. So there is planning, finances that are coming together just in regard to the 23-hour crisis relief center. We're planning on actually doing a visit to King County that has actually opened a 23-hour crisis relief center in Kirkland, Washington, just so that we can, take a look at that programming and service and learn more in consideration as the design and planning, occurs for our 23-hour crisis relief center here in Whatcom County. At this point, Health and Community Services staff is finalizing an RFP for service providers to be included early on. We wanted potential service providers to be engaged in the facility design and discussion. We figure that folks that have that kind of exposure and experience in other settings would have some really important input to meet the expectations and components and criteria of the 23-hour crisis relief center. I won't go over all the details of the RCW and the legislative language in terms of 23-hour crisis relief facilities, but very excited about bringing this particular resource to the community and doing that as quickly as possible. It's going to be a fairly sophisticated facility as well as the services, and so it's just been really enjoyable to be a part of the development of this thus far. Thoughts, comments, questions about any of that? All right. I think that Jill, I am at a conclusion of the agenda material that I had for this meeting. I don't have any other business, certainly any input at this point from anyone would be embraced, and then we can move to public comment. Right, hearing no response for additional or other business, Jill, I can turn it over to you or Gina, just in regards to public comment.
Thank you, Perry. We do have a few attendees today. If any of you would like to speak to the committee members, please virtually raise your hand now. No hands are raised.
All right, well, I very much appreciate the attendance. Understood that the other individuals, one of the things that I can do very quickly here, because I have the information. Beyond the individuals that are in attendance at this point, Maya Lisa Vanyo, Peter Frazier, Steve Harris for the Sheriff's Office, and Todd Donovan are our other subcommittee members. And again, if I disrupted the ability for individuals to attend due to the fact that I wasn't available on the initial scheduled meeting date, my apologies, but we are able to share the information, and so obviously it can be reviewed via video. So I think that that's helpful just in keeping everybody up and informed. And at that, Ms. Nixon, I have no other information.
Hi, Carol.